Hi, this is Dr. Ann Hermann with Hermann Aesthetics and Wellness, and today we're going to talk about bioidentical hormone replacement therapy. My interest in bioidentical hormones begins back in the late 1990s when I studied bioidentical hormones as a medical student and then later as a resident at a Columbia University hospital in New York. I published research on bioidentical hormones, which made it to a peer-reviewed journal and also the New York Times. What I love about bioidentical hormones is it helps my patients optimize their quality of life. The symptoms of hormone deficiency can be subtle. Often it's things like fatigue, low energy, poor libido. Sometimes the symptoms are less subtle. For women, it can be hot flashes and vaginal dryness, and for men, it can be the inability to gain muscle mass. And the way to know whether or not hormones is affecting how you feel is to get blood work. So whenever somebody comes into our office wondering whether or not they're a candidate for bioidentical hormones, we often start with a thorough questionnaire and some blood work. If you're a candidate for hormones, I recommend bioidentical hormones. These are hormones that are the exact same molecular structure as what your body makes, and therefore they're tolerated better. Also, when you see us, if there are any other issues that might be contributing to your symptoms, such as thyroid or nutritional issues, we address those as well. If you'd like more information, please give us a call or visit our website.